comment that probably 2-3 weeks ago at the White House, and I thought most of that had already been agreed to. So we agreed that we're going to waive co-payments for anything associated with COVID-19, and that's across our population. And the intent there is, one, it takes the pressure off anybody thinking they have payments to make, and we deal with a very vulnerable population with Medicaid and the low end on the marketplace, etc. But it also, the part of the motivation why we did it is it also protects the providers, because the co-payment, if it's not paid, then they take the hit. This way, we'll be covering it. So that was the motivation of it, and it's really going to be covering across our market those co-payments associated with this. So there's no need for them to be concerned about service or how the provider is going to be compensated.
I wanted to ask you specifically about... Oh, go ahead. Sorry, Michael. Finish your thought.
I was just going to answer the second half of your question. That the cost when you're our size, $106 billion this year in revenue, and the cost, whether it be $30, $40, $50 million, whatever it is, that's not the issue. The issue here is that we deal with this effectively and quickly and ensure that the population gets the care that they need. And there's a lot of talk about what's going to be services that they won't receive because they don't have access to other doctors for other services. I've commented for some time now, earnings this year are going to be lumpy. And there'll be pent-up demand, things of that nature. So we're not looking so much at the cost. We have an estimates. We are, of course, you have to do that to be responsible. But we think our shareholders will be in pretty good shape, all things considered.
Wanted to ask you about your Medicaid services, because I know that's a big part of your business. New York State released some data showing that the COVID pandemic is disproportionately affecting New York City's poorest neighborhoods and ravaging its poorest residents. So what are you expecting there, and what are you actually seeing in terms of people who have Medicaid?
Well, we expect a higher incidence of it. These individuals tend to live closer together, don't have as much room if they want to spread out when they're quarantining themselves in the house. But it's all within our estimates. We have not seen a lot of claims data yet to know what's there. So it's anecdotal at this point. But we expect a higher incidence, and are planning for it in the urban area. Some of our nurses who are not as tied up in the office are now volunteering to help within the hospital settings and clinic settings to help this population.
Michael, are you seeing yet, or are you expecting a big pickup in Medicaid enrollment based on the spike we've seen in unemployment claims?
We see a considerable spike in enrollment in Medicaid. We have a team working with the states to determine how they do that, because it's important that the enrollment be there and they'd be able to enroll and get the services. We work with the states to eliminate redeterminations and things to streamline it so it can happen quickly. We have been working on the elasticity of our services, whether it be phone services or the pre-authorization issues we've talked about. Those are things that we're really not doing a lot on when it comes to Corbett. So we see a big spike, but we're planning for it. And it should start to develop over the next, I would say, 30 to 90 days.
I saw Senator Bernie Sanders on The View today was talking about this, the fact that we need a single-payer system because of this crisis. How do you think this pandemic is going to change the U.S. healthcare system, if at all, when this is all over?
I don't think that it's going to change the attitudes of the general population in total on a single payer. I think we're going to have to be prepared for this type of thing. We have to think more about it. I've said for several weeks now, we have strategic reserves for oil. We have strategic reserves for military ammunition and equipment. We need to do that in the medical world as well. We have to be prepared to inventory the things we need when this comes up. And I wish I could say I thought this was going to be the last one. I don't think it is. I think it's going to last longer than what most people are anticipating.
Michael Neirdorff, thank you for phoning in with those new measures, the CEO of Centene.